We are live. Chidi ma'am, we are live.
Okay, so good afternoon, everyone. I am Siddhi Thakur from Department of Veterinary Medicine, Mumbai Veterinary College, and it's my pleasure to welcome you all to today's webinar organized by Entod. We are truly excited to have you all with us for this insightful session on unraveling ocular zoonotic infections in dogs. So today we are honored to have with us Dr. Pankaj Assi sir, who brings expertise and experience in this field. I'll give you all a short introduction of the speaker and the panelist. Is everyone able to see the screen? Hello? Okay. So we have our speaker, Dr. Pankaj Assi sir, from the Department of Veterinary Clinical Medicine, Ethics and Jurisprudence. Sir is a dedicated veterinarian, researcher, and educator. He is currently assistant professor in Department of Veterinary Clinical Medicine in Mumbai Veterinary College. He has done his PhD from Mumbai Veterinary College and MBA in marketing. Sir is currently pursuing PG certificate in homeopathy. Sir has 17 plus years of experience in teaching, research, and extension activities. He has taught over 40 PG and UG student courses across 6 institutions. Sir has 6 lead articles, 20 plus research papers presented on topics such as One Health, climate change, nanotech, etc. Talking about the academic participation and awards, Sir has attended various conferences and seminars, which are national and international. Sir has delivered technical services during LSD, COVID, etc. And Sir has also got Young Scientist Award in the year 2007, Best Veterinarian Award in the year 2021, and Outstanding PhD Thesis Award in 2024. Sir has presented 10 plus over 10 oral posters and poster presentation awards. Sir is recognized as LSD warrior and COVID veterinary warrior. Coming to our panelists today, we have Dr. Nilesh Dugli, sir. He's a renowned veterinary expert and he has completed his MBSc and PhD in the year 2012. Sir has 25 years of immense experience in this field and currently he is assistant professor at Mumbai Veterinary College, Research and Academia. Sir has published over 34 research papers and guided 5 PG students. Sir is co-principal investigator of 4 research projects worth rupees 3 crores. Sir has also small animal practice expertise in small animal surgery, medicine, and diagnosis. Sir is proficient in handling complex clinical cases involving dogs, cats, and other small animals. Sir has provided consultation services for small animal hospital, conducts workshop and training programs for veterinary students on small animal practice. Coming to our next panelist, Dr. Rajesh Rohi sir. He is hospital registrar and assistant professor at Mumbai Veterinary College. Sir has a Sir has a professional experience of he is a house surgeon at MBC Goregaon campus and he was earlier assistant professor at KNP Shirwar and sir has also Sir has also experience in guiding the 8 MBSc students. Coming to the academic contributions, Sir has research papers and clinical articles, like 32 research papers and clinical articles, 8 popular articles, and presented 28 papers at various conferences. Sir has also attended 35 national and international conferences, animal health camps, training. Sir has organized various trainings and are part of committee, like over 8 committee memberships. Talking about the awards and recognitions, Sir has various awards and merit. Sir has also gold medal in paper presented in radiology and imaging in ISVS. Also, an award of appreciation in ISACE 2020. So, and I am Ms. Siddhi Thakur, and today, so we will be starting our presentation on unraveling ocular zoonotic infections in dog. I would like Dr. Pankaj Asay, sir, to please start the webinar.
Yes. Thank you, Dr. Siddhi. Siddhi, you stop your sharing. Is it visible now?
Yes, sir. Yes, sir. You can start, sir.
Thank you. So, thank you, Dr. Siddhi, for introducing me in a very nice manner. Good afternoon to one and all who have joined this webinar through the different net sources. I'm Dr. Pankaj Hase, faculty at the Mumbai Veterinary College, Parel, and today I'm going to deliver this webinar on unraveling ocular zoonotic infections in dog. And with me are Dr. Nilesh Dagli sir and Dr. Rajesh Rohi sir, who are my colleagues, and as introduced by Dr. Siddhi, they are the panelists for this today's session. And I'm thankful to all these Entod Pharma executives and office bearers for timely arranging this webinar, because just 2 days back, we have already celebrated the World Zoonosis Day, that is on 6th of July. And you know well that zoonotic diseases are the diseases which transfer from animal to human beings and even human beings to animal. And in this context, this day is very important for human population as well as the veterinarians. But as far as the zoonotic diseases are concerned, most of us are unaware about the ocular zoonosis, the diseases of the eye, which can be transferred from animal to human beings and even animal to human beings. So these Entod Pharmaceuticals have rightly pointed out the need of an hour, and they have planned this webinar, that is unraveling the ocular zoonotic infections in dogs. So let's start the session. So in this continuation of this seminar or webinar, I'm going to focus 3 of the major diseases. Number 1 is toxocariasis, second one is rabies, and third one is the leptospirosis. These are the 3 important diseases, of course, zoonotic diseases, in which there is a ocular transmission is possible. So let's switch on to the toxocariasis. The other synonym for toxocariasis is the ocular larva migrans. The name itself indicates, the synonym itself indicates that there is a involvement of the eye. There is an involvement of the optic nerve. So the etiology of the disease is Toxocara canis. This Toxocara canis is an ascarid nematode parasite occurring in the small intestine of dog and free-ranging canids, including the foxes, wolves, and other families of the canids. First, for your knowledge, the picture has been displayed here, the Toxocara canis. So, in order to understand the Toxocara canis, we should know what is its life cycle. The definitive host for the Toxocara canis is a dog. The transmission is by ingestion of the soil contaminated by dogs, feces, and the parasitic eggs. Transuterine, that the infection in transfer of this infection in the uterus itself is possible. Transmammary, and last one is the ingestion of the rodents. For example, the rats, rabbits, the ingestion by the host, the transmission is possible. This is just for your knowledge. What is the life cycle? We already discussed that the definitive host is the dog, and when the eggs pass in the feces, they go in the different phases in the external environment. That is, the unembryonic eggs get transferred into the embryonic egg with the L3 larva. And when this L3 larva get ingested, and then there is a adults in the small intestine of the definitive host. In the last phase of this cycle, this can enter into the human being and human cycle due to the ingestion of these Toxocara eggs. So this 11th number is the system or human system wherein there is a occurrence of human being as a zoonotic importance. So what is the zoonotic risk? If we see, dogs which are in close contact with the human are the major source of zoonotic infection. Infection may also occur via the soil contaminated by the dog feces and is particularly common in children which are having the habit of geophagia, which are having the habit of eating soil. So, zoonotic risk also includes the consumption of the raw or uncooked vegetables. It also includes the water sources contaminated with the dog feces. Veterinarians are always at risk due to the infection of the handling of the fecal samples or while treating of the infected puppies. So, this is about the zoonotic risk as far as the Toxocara canis is concerned. In continuation of the zoonotic risk, following ingestion, the eggs hatch and they penetrate into intestinal wall and subsequently disseminating via the circulatory system to the different tissues, including the liver, heart, lung, brain, and the last one is the eyes. Although larval development cases of these they still induce localized reactions and there is a mechanical injury resulting into the clinical toxocariasis. So, clinical manifestations, if we see, there is a case in the human being that is the 8-year-old boy with a history of puppy and exposure which failed his school in the right eye. There is a fundus examination revealed old scare involving the macula and serum testing for anti-Toxocara antibodies were positive. So this is the way of zoonosis by which there is a transfer of infection from the animal to human being. So if you see the clinical manifestation, ocular larva migrans, that is OLM, ocular toxocariasis. This occurs due to the migration. Okay, ocular larva migrans or ocular toxocariasis. This is also the synonym for toxocariasis. This occurs due to the migration of this microscopic larvae to the eye, causing the eosinophilic inflammation and scarring on the retina. You can very well see that there is a eosinophilic inflammation. Eosinophilic inflammation, because whenever there is a parasitic infestation, in that case, the eosinophil count is going to increase. The body reacts to the larvae by forming the eosinophilic abscess followed by granuloma formation around it, which may be misdiagnosed as a retinoblastoma. So this is a very important differentiating point for a clinician to distinguish between the retinoblastoma with the eosinophilic inflammation due to the ocular toxocariosis. If you see how the extraction of the larvae is being done in the human, one video is being presented for you. This is a wonderful video in which there is a zoonotic importance have been highlighted, and you can see this extraction of the larva from the human eye, and that video itself depicts that how this infection is very hazardous as far as the eye of the human is concerned. What it causes? It will cause the visual impairment, strabismus, that is the nystagmus, leukocoria, that is the white pupil, then retinal mass predominantly at the posterior part of the vitreous mass or haze, vitreous retinal detachment, cataract, endothalamitis, and papillitis, and uveitis, inflammation of the uveitis. That is the membrane of the eyes. Also, there is irreversible blindness in the human beings and also in the animals, and there is a secondary glaucoma. If you think about the other clinical signs, there is a visceral larva migrans in which there is the invasion of these larvae into the spleen, muscles, heart, and lungs. That means there is a inflammation, and due to that there is a splenomegaly, there is a cardiomegaly, and there are even the chances of the pneumonia due to the invasion of these larvae into the lungs. Ultimately, it will be, and there will be fever, myalgia, cough, rashes, and there is a hypereosinophilia. There is an increase in the count of the eosinophils. Central nervous system migration, if you see, there is a neurotoxicariosis, that is the affection of the nerves, that is the neural larva migrans is infrequent and result in the eosinophilic meningoencephalomyelitis. Of course, when there is an entry of this larvae into the nervous system, there are chances of the death, and the incidences have been recorded in the human beings as well as in animals. What are the clinical signs as far as these manifestation in dogs is concerned? There is a dull coat, pod belly, and may pass or vomit in the worms. You can find the vomits in the worm, and this is a very important diagnosis for the clinician, that presence of the worms in the vomits of the dog. There is a diarrhea with the mucus. It is a very common phenomenon. Early toxocara infections can cause coughing due to the eosinophilic pneumonia from migrating larvae. We have already discussed that larvae can enter into the lung, they can enter into the liver, they can enter into the spleen. So if they are entering into the lung, they definitely going to cause coughing due to the eosinophilic pneumonia. In puppies, heavy Toxocara canis infections may lead to verminous pneumonia, ascites, fatty liver, mucoid enteritis, and kidney granuloma with larvae. So this is about the clinical manifestation in dogs. If you see about the history, diagnosis, the diagnosis is totally mostly based on the history. History of exposure of puppies or kittens or pica, or we already discussed the geophagia like behaviors by kids. The clinical signs and symptoms, for example, blurred vision. Many times the clinicians do not think of this disease, that the blurred vision, and there is some retinal damage and vision loss. Laboratory findings also helps in the diagnosis. For example, blur picture. If you go for the blur picture, you can detect the eosinophilia, and if you go for the serological test, then you can find the eosinophilia antibody detection test. That is a enzyme immunoassay test with the Taxocara excretory antigens obtained from in vitro cultured third stage larva. And when a titer of more than or equal to 1:32 is there, it is considered as a positive for the Toxocara canis. In continuation of this diagnosis, further serological confirmation of the ocular Toxocara canis can be made by testing aqueous or vitreous humor samples for the antibodies. You can collect it, and paired serum samples may show a significant rise in the antibody titer over time, confirming the active infection. So, as far as the dogs are concerned, we can notice inappetence, we can notice the omissions, and in the omissions, you can detect even the parasitic parasites of Toxocara canis, and there is a diarrhea and worms in feces can be noticed. When undewormed young puppies, it can also be considered as a major history for confirmation of this disease. Clinical signs include slight moderate to dehydration, slightly pale mucous membranes, hematochezia or melena may be present due to the presence of this parasite in the liver itself, which may lead to the melena. Laboratory finding, already we discussed in the last slide, that is the examination of the fecal sample, presence of the brownish, spherical or unembryonated Toxocara canis. The photo is for your information. So, very important, the presence of the cephalic ellie at the anterior end of the worm confirms it as the Toxocara canis. What will the treatment? If there is a involvement of the eye, then you can go for the antielementics and topical or systemic corticosteroids. You can go in the parental pomade at the dose rate of 5 mg per kg body weight for orally for 3 days. Parental works very nicely at the dose rate of 50 mg per kg body weight at 2 weeks interval orally. And very important is the routine fecal monitoring for the eggs and live worms is equally important. If you see about the treatment, further treatment in dogs, supportive therapy, that the parenteral fluid therapy, for example, DNS or RL to correct the dehydration, antiemetics, ondansetron, then antacids, pantoprazole, ranitidine, vitamin B complex, and oral hematinics can also tackle the anemia. These are the supportive therapy inclusions. How it is the public health measures or control measures. Regular deworming of the dogs, especially lactating dogs and their puppies, is very much important. So preventing defecation by dogs in the public areas and their proper disposals of the fecal sample or fecal material is equally important. Then fostering the pet hygiene and educating the pet owners, parents regarding the risks is can prevent this disease. Then educating the children on personal hygiene and discouraging the geophagia. Don't allow the children to have a maximum contact with the soil so that transmission can be avoided. The second disease, as far as the ocular zoonosis is concerned, the second disease is rabies. Rabies only we know in case of dogs, and whenever there is a salivation, excessive salivation, we know it as rabies. But many of us don't know that there is a transmission of this rabies virus through the ocular way, that is the through eyes. So this is also lacrimal secretions is also one of the important way of transfer of this disease. So what is the etiology of this rabies? Genus is Lyssa virus and family is the Rhabdoviridae. It is a bullet-shaped neurotropic virus, and all warm-blooded animals are prone to this disease or susceptible to this infection. How this disease transfers? Then this transmission occurs by bite of a rabid animal. This is very common transmission route we know. Then rabies virus can penetrate the mucous membrane of the eyes. Very important as far as this zoonotic importance is concerned. The rabies virus can penetrate the mucous membrane of the eyes, even nose and mouth, and thus aerosol infection laboratory technicians is possible in a rabies laboratory by accident. So when we are thinking that unless and until we touch the dog, rabies suspected dog, the disease cannot be transferred. So this technical information have made this statement false because this rabies virus can penetrate the mucous membrane of the eyes. Again, the virus is excreted in the saliva 3 to 8 days prior to the manifestation of the clinical symptoms in the infected dogs. And even it has been documented that the virus have been reported 5 days before in the lacrimal secretions. If we say about the pathogenesis, the virus replicates locally at the bite site in the epithelial and muscular tissues. Then the virus moves centripetally, that is towards the brain. Centripetally is towards the brain to the CNS via the nervous pathway as the infection progress. After centripetal, there is a centrifugally, it spreads to the whole body. After it reaches to the brain, the virus invades the ganglion cells and spreads centrifugally to the peripheral nerves, facial, glossophageal, and trigeminal, and mainly the optic and olfactory nerves. It also reaches to the salivary glands, thymus, lymph nodes, eyes, and kidneys. The virus damages the brainstem and medulla, causing the irritation and excitability, leading to the encephalitis. We know that if the picture of the rabies in front of our eyes, we know that there is a drooling of the saliva and a roaming dog around us. That is the picture we know. So death of such rabid dog occurs due to asphyxiation or due to the paralysis of the respiratory muscles. What you can observe in the clinical manifestation in man as far as the ocular diseases are concerned. If we see the rabies virus ocular disease, this occurs via the two way. Number one, direct eye injury or via scratches. Or secondly, when pre-operative screening fails to detect the rabies virus during the corneal transplant. Corneal transplant. Hello, am I audible?
Yes, sir. Now you're audible.
Shall I continue?
Yes, doctor, please.
Yes, sir.
Okay, so clinical manifestation in human eye, we were discussing retina or retinitis occurs by the
Sir,
neutrophilia.
your screen is not visible. Screen share is slide. You can share the screen also.
Okay. Now it is fine.
Yes, sir.
Okay. So retinitis occurs by neutrophil and T cell infiltration after the brain infection. Whenever there is a brain infection, at that time, there are chances of the retinitis. That is the infection of the retina. And the endothelial damage and inflammation of the retinal veins with the exudate spilling into the retinal layers occurs. And there is a temporary vision issues and light sensitivity. We call it as a photophobia, and blurred disc margins are seen in case of the human eye. So you can understand the how this virus is causing the damage to the retina and even the eye of the human. If we see progression of the rabies in the man and dogs, there is a prodromal stage which is characterized by the fever, headache, and malaise, and there is a pain and tingling in the affected limb. The excitement, which is a very clinical sign, important clinical sign of the rabies, in which there is a hypersensitivity, hypersalivation, seizures, and there is a hydrophobia. In the final paralytic stage, there is a paralysis of the respiratory muscles followed by the coma and death. If we see the clinical manifestations in animals as a general symptoms, there is a fever, of course, omissions, excessive salivation, paralysis of the lower jaw, anxiety and restlessness, and convulsions. And there is also the progressive paralysis. Outcome generally is the death, usually occurs within the 5 to 7 days after the onset of these symptoms. How to confirm, how to go for the diagnosis? If we want to go for the diagnosis, history is very important. That is the history of the dog bite or the scratches on the skin with the bleeding, recent corneal transplant. It includes the clinical signs, further tingling and pain sensation at the site of the bite wound, muscle flaccidity and spasms. These are the very peculiar signs, clinical signs as far as the rabies is concerned. In advanced stages of the rabies, the eye shows abnormal movements and neurological vision issues, and also there is a nystagmus. If we take the help of the laboratory test, corneal smears, very recent concept, corneal smears are prepared by pressing the glass slides on the eye. In the Department of the Microbiology of Mumbai Veterinary College, we do go for this test, that is the corneal smears preparation, and direct fluorescent antibody technique for the detection of the inclusion bodies for the rabies. So testing of the saliva and skin biopsy samples from the nape for the rabies is carried out by the PCR test, which is the real-time PCR, which is a proven technique. Virus neutralization test and the counter immunoelectrophoresis, these are also the other serological test which helps to detect the antibodies against the virus in the serum. What about the treatment? Unfortunately, there is no treatment, no cure. Once a dog shows symptoms of rabies, it is invariably fatal. So, quarantine is also the part of the management. I will not say it is a treatment, but it is a part of the management. If a dog is suspected of having rabies, it will be quarantined for observation, typically for 10 days. In many cases, especially with the unvaccinated dogs, euthanasia is recommended to prevent further spread of the disease. Post-exposure prophylaxis, that is the humans and vaccinated dogs, is a PEP. That is very crucial after the exposure. So, next disease, as far as the ocular zoonosis is concerned, we discuss about the toxocarasis. We discuss about the rabies. Now, third one and very important, leptospirosis. Already Mumbai and the metro cities of India experience this disease in many monsoon seasons. In last 1 or 2 decades, leptospirosis. It is a pathogenic leptospira species, which is a thin spiral bacteria. Then leptospira introjens is the most common in dogs and even in the human beings. If we see about the etiology, earlier this canicola and icterohemorrhagica were the common. But as far as the recent studies are concerned, the serovas like pomona, leptospira pomona, have become very common and popular. In India, this pomona has been found in otters, dogs, and humans, and zoonotic transmissions. So let's see this video of leptospira, how it looks. It's a very tiny bacteria which having ability to transfer from the human beings to animals and also animals to human beings. So these yellow arrows indicate these anchoring points. So this is just for your information. So if you see about the transmission, how this leptospira transfers. In animals, there is entry contained in the soil, water, or mating or reproductive fluids. Also, the waterlogged area, they are the most best resources for the transfer of this infection. This ocular localization in the reservoir host organisms can persist in the eyes, contributing to the uveitis. In humans, how this transfer, there is accidental host. For example, entry via the abraded skin, mucous membranes. For example, mucous membrane of the eyes, mouth, and nose. After contact with the contaminated urine, majorly the urine of the rodents, and water or soil, rarely through the ingestion of the transplants, and virtually never human to human have been reported. The incubation period about this leptospira is 2 to 30 days and average is 7 to 14 days. This life cycle picture itself depicts that how this rodent play an important role in transmission of this leptospira infection from animal to human beings and even from the human beings to animal. The urine of these rodents is full of leptospira organisms, and these eggs ingested by this definitive host act as a major source of transmission. There are two-way transmission, that is the indirect and the direct transmission. Indirect transmission occurs through the contact with an infected animal. You can see here an indirect transmission. This occurs through the contact with the contaminated urine, water, or soil. So this picture is a self-explanatory. Then how this disease progression? Leptospermic phase, in which there is a acute fever, myalgia, headache. And when it is the immune phase, the antibodies appear, organisms localized in tissues, majorly in the vital organs, for example, kidney, liver, and eyes even, causing the more severe disease. Renal shedding have been reported up to 60 days in some of the cases. Renal shedding. If you say about the clinical signs in dogs, fever is common, lethargy, vomissions, diarrhea, anorexia, abdominal pain, jaundice. There is a involvement of the liver, and due to that there is jaundice, polyuria and polydipsia, kidney involvement, dehydration, muscle pain, and stiffness. We at Mumbai Veterinary College Hospital Clinic, we do receive the many suspected cases of this leptospira, and in which there is the involvement of both liver as well as the kidney. And on clinical examination, we could palpate the enlarged liver, that is hepatomegaly, and also there is a nephropathy. In continuation of this clinical signs, there are the petechiae or ecchymosis, that is the bleeding spots, especially on the gums or skins. Then the hematuria, blood in the urine, can be recorded, can be found in this leptospira. Dyspnea or pulmonary hemorrhages in severe cases can be recorded. Kidney involvement and the liver involvement are the major involvements as far as the leptospira is concerned. So, what is the ocular manifestation of this leptospira in dogs? There is a conjunctival suffusion, that is a reddening of the conjunctiva without discharge. There is a uveitis, inflammation of the uval tract, and these signs include the redness of the eye, photophobia, that is the very sensitivity to the lights. There is a miosis, aqueous flare, and there is a hazy appearance. These are some ocular manifestations as far as rabies is concerned in the dogs. In continuation of that, there is a hypemia, that is the blood in the anterior chamber, which is there have been reported, but is also rare. Then there is a retinal hemorrhages. Then the chorioretinitis, that is the inflammation of the retina. Then the cloudiness or hazy picture or opacity of the eye have been recorded in the few of the dogs suffering with the rabies. What you can find in the humans in early phase, that is the leptospermic phase, there is abrupt high fever, severe muscle pain, nausea, vomition, diarrhea, constipation, and rash. In less, this is less common but have been noted. In the late phase, that is in the severe form, there is a renal failure, there is a jaundice due to the liver, even there is a hypotension and there is a meningitis. In the late phase, it has been reported. This is a very clear, typical picture as far as the clinical signs in human of the this leptospira is concerned. These rashes on the limbs have been reported. These ocular manifestations in humans have been noticed. Conjunctival, this suffusion, that is the hallmark sign, that is the redness of the eyes, bilateral with the no purulent discharge. It have been reported more than 50% of the cases. You can observe in the picture subconjunctival hemorrhage due to the vascularitis or capillary damage. Then there is a anterior uveitis, especially in the immune phase. There is anterior uveitis. Then there is a pain, blurred vision, and photophobia. That is a sensitivity to the light and visual disturbances, mainly the blurred vision or floaters. These are the ocular manifestations in human beings due to the leptospira have been noticed. How to diagnose leptospira? You go for the history, clinical signs. Jaundice is a very cardinal sign or important sign. Renal or liver failure. If you go for the hematology, of course, if it is a jaundice, the one values have to increase. Creatinine and also the ALT, ALP, bilirubin levels are also increased. Leukocytosis or thrombocytopenia is also the major clinical picture. If you go for the urine analysis, there is a proteinuria, loss of proteins from the urine. Pyuria is also there. You can go for the specific tests, for example, MAT, PCR, and ELISA to detect the IgM for confirmation of this leptospira. The treatment, it is a well-established treatment as far as the leptospira is concerned. You go with the doxycycline, 5 to 10 milligram per kg, orally twice daily for 14 days. Then steroids, prednisolone acetate or dexamethasone, every 6 to 8 hours interval gives better results. Atropine 1% eye drops. Atropine 1% eye drops once or twice daily also gives better results. The non-steroidal anti-inflammatory drugs, for example, caropropane, meloxicam, and these are indicated only when there is a no renal disturbance or renal function is stable. Only in that condition it is advisable. Lubricant, artificial tears or 2 to 4 times daily prevent to dryness. You can use, and intraocular pressure monitoring is very, very important as far as the treatment of the dogs is concerned. That you should also check for the secondary glaucoma, and definitely some of the medicines, eye drops, will help to control the glaucoma, and also to maintain the wetness of the eye. The lubricants will definitely help. How to control? Vaccination of the dogs and livestock with the DHPPIL for the dogs. Rodent control programs in urban and rural areas. Public awareness is very, very equally important. For chemoprophylaxis, you can go for the doxycycline 200 milligram weekly for the high-risk individuals during the outbreaks. Then proper sewage and drainage management is very, very important. Then reporting and surveillance is also important as a part of the integrated disease surveillance program, that is the IDSP. So in this way, we can control this leptospira. Then what are the zoonotic aspects of this leptospira? This is considered underreported due to the misdiagnosis as a dengue, malaria, or typhoid. Many times it goes undiagnosed. So if it goes undiagnosed, then it has to be transferred from the human beings to animals and animals to human beings. So diagnosis is very, very important. Outbreaks reported during the post-monsoon months, July to October, are important. Direct contact with the urine, blood, or tissues of the infected animals, especially with the rodents, cattle, and dogs. And entry through the skin cuts, abrasions, or mucous membrane, mainly the mucous membrane of the eyes, nose, and mouth. So this is a picture. Monsoon season is going on. Be careful from the rodents, and don't be with the barefoots in the monsoon, so that you may suffer with this leptospira. So it is a very great importance as far as the zoonotic aspect is concerned. So what is the general care for the ocular zoonosis? This is now I am at the fag end of this session. So maintain the eye hygiene, clean discharge daily, isolate the infected dogs, avoid sprayed if it is of infectious nature, vaccinate your pets regularly, especially against the canine distemper or leptospira. Control flies, vectors, prevent thalassemia, avoid irritants, for example, dust, smoke, harsh shampoos, and of course, the regular veterinarian checkup is very important for the early detection and treatment and control of this zoonosis. So in conclusion, the modern times have seen a dramatic increase in the proximity of the man and dog, which has accelerated the risk of zoonotic disease because there is a close vicinity between the human and animal. So transfer of the zoonotic disease have been become very simple. It is equally true that with timely deworming, routine vaccination with basic hygiene practices, the risk of zoonotic transmission can be significantly reduced. And by working together with the veterinary professionals, general physicians, and adequate One Health awareness, we can definitely break this zoonotic chain. So I already discussed this one. So thank you very much for the patience hearings. Thank you all the audience. Thank you panelists, and thank you this executives of this Entod Pharma. I am very thankful to my students Soham, Mrunmay, and Vedika for this helping in preparing this presentation. Thank you very much.
First question was, can zoonotic diseases in dogs be cured? Like completely cured?
Yes, it can be cured.
Siddhi ma'am, can you please unmute yourself?
Hello, am I audible?
Hello. Hello. Hello, am I audible?
Yes, Siddhi ma'am, you can continue, please.
Hello.
Siddhi ma'am, you're audible.
Okay. So I was thanking Dr. Pankaj sir for the insightful presentation. Audience has been actively participating and dropping questions in the chat box. So I would request Dr. Pankaj sir to please address them now. So the first question comes with, can zoonotic diseases be cured? Like ocular zoonotic diseases can be cured completely or not?
Okay, it depends upon the type of the zoonosis. When there is a transmission of the rabies, of course, we know it is a very fatal disease. But when it is of leptospira origin or some toxocara origin, definitely they can be cured.
Okay, thank you, sir. The next question is, do infected dogs need to be isolated during the treatment?
Can you repeat the question, please?
Yes, sir. So the question is, do the infected dogs need to be isolated during the treatment?
Yes, during treatment, in order to avoid the zoonosis, the infected dog needs to be isolated. Even there are chances of transfer of the disease through their urine, through their secretions, and through their fecal content. The disease can be transferred. So the isolation or keeping away these dogs away during the treatment even is a very good practice.
Okay. So the next question is, what disinfectants are effective against zoonotic eye pathogens?
I'm getting I'm trying to understand the question. Will you please repeat,
Yes,
Siddhi?
sir. So, what are the common disinfectants that are effective against eye pathogens? Common disinfectants, sir.
Common disinfectant. Okay, you can go with the 0.1%, even the NaCl or sodium chloride solution, which helps in again the maintaining the lubrication of the eyes and even making these disinfection proper way.
Okay, sir. So the next question is, are there vaccines for preventing this zoonotic ocular diseases in dogs?
Ocular, no,
Yes.
at present, no special vaccines as far as the ocular diseases are concerned. No specific vaccines are there. The vaccines are in combination. Vaccines are in combination and not specific for the ocular zoonotic diseases.
Okay, so the next question is, what diagnostic test help identify zoonotic eye diseases in dogs?
What?
So what diagnostic tests help to identify zoonotic eye diseases?
Mainly the serological test, that is the ELISA, PCR, and if it is of a Toxocara origin, then you can go for the fecal examination. These are the commonly used tests, and they can help in diagnosis of the zoonosis of these diseases.
Okay, and the last question is, sir, can ocular swabs from dogs help to detect the zoonotic pathogens?
Will you please repeat?
Ocular swabs, sir. Swab from the eyes can help to detect the zoonotic pathogens or not?
Yes, of course, because lacrimal secretions also contains the virus. We have already discussed that the rabies virus may present in the lacrimal secretions. So if you are taking the swab, definitely it will help in the detection of these ocular zoonosis.
Okay, sir. Thank you. We are done with the question answer session. So on the behalf of entire organizing committee, I, Sadi Thakur, feel privileged and delighted to deliver the vote of thanks for our today's insightful session. And first and foremost, I would like to express my heartfelt gratitude to our distinguished speaker, Dr. Pankaj Hase, sir, for sharing his valuable knowledge, practical insights, and clinical wisdom. Your session truly expanded our understanding, sir, of ocular zoonotic diseases
Thank
and their
you.
relevance in clinical practice.
Thank you.
I sincerely thank our esteemed panelist, Dr. Rajesh Rohi, sir, for his presence and support from Mumbai Veterinary College.
Thank you.
Special thanks to Entod Pharmaceuticals for the continuous support in making this academic initiative possible. I would also acknowledge the efforts of Ophthalmology Clinical Club of India and Ento Meet series for providing such a meaningful platform for continuous veterinary education. To all the veterinary students, clinicians, and academicians who joined us today, thank you for your active participation. Let us carry forward the knowledge and awareness we gained today into our daily practice and continue towards better animal and public health. Thank you once again, everyone. Stay curious, stay connected, and have a great time ahead. Thank you.